Can goats empower women? In the poorest areas of India, they already are. This is thanks to a heroic team of health workers called Pashu Sakhis.
1/6 of the world's population of goats is in India. They are such a strong source of livelihood for very poor people.
बकरी तो एटीएम की तरह है, जैसे कि अगर कोई जरूरत हुआ तो हम अभी बेच सकते हैं.
So it's not easy being a woman anywhere in the world.
हमेशा सोचते रहते कि नहीं, तुम घर से बाहर तुमको नहीं जाना है, कुछ भी नहीं करना है.
Goat rearing is primarily done by women. They manage the goat flocks, they take them out for grazing. They are the ones who first spot the signs that a goat is unwell. What we're trying to do is empower women to have a much greater control over the income that they get from goat rearing. When women own the income that they earn, that income is used for the betterment.
More than 20 years ago, Rwanda was torn apart by genocide that killed nearly 1 million people. As Minister of Health, Dr. Agnes Binagwaho led the incredible turnaround of Rwanda's healthcare system. She's now Vice Chancellor of a new university in Rwanda dedicated to improving healthcare in the world's poorest communities.
What has happened in Rwanda over the last 20 years? It's everything except a miracle. It's hard work of thousands and thousands of health professionals, of caregivers, and of people who have thought all along those years, how can I do better today than yesterday? We have found how to move Rwandan together. And I love the international assessment who say the best place to be born a girl in Africa is in Rwanda. By creating a health sector targeting the most vulnerable and focus on decreasing gender disparities, we have rebuilt trust, and it makes people willing to care for themselves and to support a system that wants to care for them. Everything that Rwanda have done is in a way or another replicable. And that's why we have created the University of Global Health Equity. It's an university based on equity, how to create a health sector that is human rights based and that targets the most vulnerable by educating young people to provide the type of healing embedded in the principle of global health. I'm going to have the sense that my work will change the world.
We're talking about primary health care in Africa and some of the great stuff Last Mile Health is doing to help that work even better.
My name's Raj Panjabi. I am a physician and I am the CEO of Last Mile Health, and our work is to train, equip, and pay people from remote communities as healthcare workers, essentially go door to door to bring healthcare to their neighbors' doorsteps. My parents immigrated to Liberia from India in the 70s. I was born there and raised there until the age of 9 when a horrific civil war drove hundreds of thousands of people, including my family, out. During medical school, I went back to Liberia to see if I could serve the people we'd left behind. There were just 51 doctors for a country of 4 million people. In rural parts of the country, I was seeing my patients die from conditions really no one should die from in the 21st century: pneumonia, malaria, simply because they were living days from the nearest clinic. I started Last Mile Health to save lives in the world's most remote areas. Last Mile Health literally means healthcare for last mile community. Things like testing a child for malaria, or treating a child for pneumonia, or using a measuring tape to screen a child for malnutrition, helping a mother organize a birth plan so she can deliver in a clinic. These are interventions that are proven to save millions of lives. What we've seen is that if we invest in how they're trained, equipped, and pay them instead of considering them as volunteers, you can have some dramatic results. The Community Health Academy hopes to modernize the education of community health workers using digital content to create the largest army of community health workers the world has ever known. And community members are deeply motivated to serve their people. They want to learn. Over time, governments are willing to pay for these workers because they actually have a great return on the investment to society.
Digital training, I'd say that's very much on the cutting edge, and it's great to be trying that. You're doing some pioneering stuff, which is very exciting.
There's still millions of people dying from preventable causes. Creating a national workforces of community health workers, we could save millions of lives in those countries.